Any discussion? All in favor, say yes.
Yes.
Opposed? Motion carries. We call this meeting to order. Let's stand for the pledge of allegiance. I pledge allegiance
To the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
I was trying to get in. Yep.
Yeah. Standard.
Andrew.
Yeah.
All right, I'll do the roll call. Mark, what do we know about Kim?
Just that we received word that she was readmitted to the hospital for, I assume, her leg or bones or whatever it was, her fractures. Yeah, so that's what we know.
So obviously excused absence.
Yeah.
Okay, Glenn? Here. Jessica? Here. Just to let you know, Craig Benby was asking about you. How you're doing. Oh. That's what we'll let you know. Mark?
Here.
Crystal? Here. Gail?
Present.
Beth? Here. Here. Marcia? Here. Jane has an excused absence, I guess, call being at, what is it? Somewhere.
Someplace with sun.
Deb? Here. And Karen? Here. Okay, we have a quorum. Okay. This is our minute for, public. Is there anyone in the public who wishes to address the board on agenda items only? Nobody's raising their hand. There'll be another opportunity later. If you wish. Does anyone see, or wish to add anything or change the agenda? I'm just going to request that we moving into closed session to being after that second provision for the public. So they don't have to wait till we get back out of it to have a chance to speak to the board. I can move this, or do I have to ask for a motion? Any support for that?
Support.
Any discussion? Anything else we should add or change? Okay. All in favor, say yes.
Yeah.
Opposed? Okay, move that. All right,
Do you need an actual motion to approve the agenda as amended?
did we just do that, or did we just approve my motion to change?
I thought it was your motion to change.
Okay,
Motion to approve the agenda as.
as amended. Yeah, thank you. Any support for that?
Second.
Any discussion? All in favor, say yes.
Yes.
Opposed? Motion carried. Okay. Anybody see anything? Well, so we, this is different from other. The minutes are all in one in that consent agenda. Does anyone wish to remove any of those items to discuss them individually or make any changes? If not, may I have a motion to approve all the items in the consent agenda?
Move to approve the consent agenda as presented.
Support? Support for Jessica. Any discussion? All in favor, say yes.
Yes.
Opposed? Motion carried. Today's program committee meeting was canceled, so we will move on to Beth's report.
Oh, time up. Okay.
One
All right, starting,
That's,
point of order,
oh, I'm sorry.
shouldn't we be going and putting that presentation schedule so they have everything in line for next year?
I asked about that and I was told that it can wait until January to be presented and approved.
Thank you.
Okay. All right, over on page 6. For human resources, they are still going through and rolled out to staff, for more policies that are listed in that paragraph. They are working through the employee handbook with Raymond, and they're starting to identify gaps in it. The employee climate survey focus group, they continue to have weekly meetings between the human resource team and the Raymond consultant to develop supervisors training curriculum. We've had a handful of people go to different conferences over the last month. And everybody is enjoying the Folks for Fun Employee Activity Committee. IT, their Elios is that electronic dictation that's going to hook into our EMR, and that is continuing to go forward. And there is a new employee, Lewis, and his acronym is HAM for Health Analytic Manager, Analyticals. What is it?
That's it.
Yep, okay, manager. And he's gonna work on having better reports and in using the EMR and the ad hoc reports through Rubik's IT, just so we have better data and we can manage things better. The big news is that the USDA loan, it has come to a final close. We are live data feed with Allegan Courthouse, and it was a good day at OnPoint. And so going on to the next good day was when the government opened back up, that meant our HRSA funds were flowing again, which started the mat renovation on the other side of the building. So any questions on what's going on there? Okay. On page 8 and 9, we have to pay some bills and so forth. So I make a motion that the OnPoint board approve the November 2025 disbursements totaling $3,843,005.91.
Report?
Yes.
Any discussion? Roll call vote. I'll start with you, Glenn.
Yes.
Jessica,
Yes.
Mark,
Yes.
Crystal,
Yes.
Gail,
Yes.
Beth,
Yes.
I say yes. Marcia,
Yes.
Deb,
Yes.
and Karen.
No.
Motion passes.
Okay. The next thing we have to do is add a couple of providers to the contract list for the provider contracts for the fiscal year. I recommend, or I move that the OnPoint board approve the following list of provider contracts for fiscal year 2026. And they're listed on page 5.
I have a motion. Do I have support?
Support.
Jessica. Any discussion? I will roll call again. Karen,
Yes.
Deb,
Yes.
Jane, oops, Marcia,
Yes.
I say yes. Beth,
Yes.
Gail,
Yes.
Crystal,
Yes.
Mark,
Yes.
Jessica,
Yes.
Glenn.
Yes.
Motion passes.
Okay, moving over to page 11. We're not going to read that whole paragraph, but it's a little disclaimer for the financials this month. what it basically says is that OnPoint is working with the provider of our EMR, our electronic medical records, and the MDHHS to set it for the fiscal year 2026 for reporting requirements and so forth. So data's not flowing through the EMR and so forth. So October, some of the numbers are estimated. As soon as they get through that process, then the actual numbers will come through next month or thereafter. Yeah, right, next month. Just to know, the October expenses are the actual expenses. And then they estimated the revenue to match the expenses this year. There is no balance sheet because fiscal year 2025 hasn't closed yet. That will probably close the end of January. Then, just on another note, a new thing that's happening with the CCBHC is that the money from Lansing used to flow through the LRE or somewhere.
Yep,
And now it's gonna come directly to us. So it's a different flow of the funding for the CCBHC. And we're looking at the actual visits for October when we get to that point. So moving over to page 12. For the month of October, and this is all preliminary because it's estimated, but it looks good. There's 202,000 on the far right, going back to the LRE, and this is estimated. And looks like the CCBHC came out with about $73,000 for the month of October. It's not looking all that bad. If you got to page 13, we have a new page 13. It was one Megan passed out. Basically, 1 month is 8.3% of the year. A couple of things that are high on the revenue side is Healthy Michigan capitation and the CCBHC capitation and supplemental. The Healthy Michigan, basically, they're still not disenrolling. We still have a healthy amount of enrollees on that. If you go down to the percentage for operating revenue, 7.7%. Total expenses, 7.6%. So our revenue was higher than our expenses on that, and that's what we look for. Overall, the change in net position on the very bottom was 92,750 for the month. Is there anything else? Oh, one more thing on the CCBHC. They are starting to look at the budget for this year, and October being the first month of the 26 budget. They are looking at having 33,297 visits for the year. Right, Gina? That's right. Averaging about 2,775 per month. And you think, that blew my mind. And then Andre said, well, for October, we had over 3,000 visits. So good job again to everybody who's, making that work. So it's going well for the first month. Anybody have any questions? Want to add anything? Okay. That's it, for my report.
No questions for Beth? All right. Glenn, would you please give us a report from your meeting today?
I would be happy to. We first reviewed the status report from September to November, which is page 7 packet if you want to follow along. So in general, the allegations aren't changing too much. There's some ups and downs in a couple of categories. The biggest concern our director Kelsey had was the abuse one and neglect one being reported. Some good news on that sheet is under the less than 30 days to close allegations, we are up to 13. And I believe it was 11 last quarter, so they're working harder, faster, better, efficient. And then we did review our annual report that was approved to be submitted to the state, and it will be available for review the entire board next month. A couple of things from there. Our allegations substantiated are at 39%, which the state average is 30. However, we are trending down because last year we were at 48%. Kelsey's had some time to do some analyzing, and she found that on the service suited to condition, we had 17 substantiated claims or findings. However, that was seen as a better thing because it's kind of preempts and things from escalating to where there could be harm. So it may look like a high number, but it's a relatively good high number. Then we reviewed, there's going to be some policy revisions to continue, increased training for supervisors, and standard clarification on trainings, stricter trainings, and but also user-friendly flow of training if it's stricter. And then we discussed some recommendations for 2026 that are going to be in the report submitted to the state. And that is the gist of it all around. And yeah, the report will be available for the entire board next month. Any questions? Sorry.
Thank you.
Oh, I'm sorry, I forgot. We as a committee unanimously agreed that the RAC team, the rock stars.
Oh, that's very good.
Now I'm done.
Awesome. Thank you. Mary or Stephanie or anybody here today from the LRE?
Yes, good evening. I'm here. Are you able to hear me okay?
Yes, can you hear us?
Yes.
Okay.
All right. Well, I have a couple updates for you. Wanted to let you know that we did have an oversight policy board meeting on December 10th. During that meeting, we did approve a PA2 reserve request for the Allegan Drug Court. The other item that I wanted to mention as well is that we're doing 2 advocacy areas through Oversight Policy Board. And one of those is regarding tobacco licensing. And I'm sure some of you recall probably Heidi Denton talking about this previously when she's reported to the group. But one of the things we're required to do across the state of Michigan is what they call signer checks. What those are is when we have to go into a location that sells tobacco, we would take a youth decoy, so somebody who's underage, and attempt to purchase either cigarettes or vaping products. Depending on how the clerk handles that, if they were to sell to them, the ticket would go just directly to the clerk. It does not go against, say, the gas station, or if it's, a different type of location, such as, a box store like Meijer, something like that. One of the other things with it as well, too, is we are also required to keep a master list of all the tobacco retailers. And one of the things that we are struggling with is that because tobacco is not licensed, there is no master list that exists. So we at the PHP are responsible for that. And it is simply, truly word of mouth. So if you're out driving around and you see a new gas station, please let Heidi or I know, because that's how we have to keep track of this list. So one of the things advocacy-wise that we're actually getting excited about is there is a couple of Senate bills. It's Senate Bill 462, 464, and 465 that would actually license tobacco. It was passed by the Senate last week, Tuesday, and it is supposed to be going to the House tomorrow. Fingers crossed it's going to happen. So hopefully they can get this proposed and potentially voted in so we could actually have tobacco licensing. if you're not quick following along with why we want this, because every other legal drug is licensed. So alcohol has licensing, so does cannabis or marijuana, whatever you want to call it. And again, tobacco doesn't. There's only 9 other states that do not have this. And recently Kentucky just passed legislation to do this. Kentucky, friends. So that's where tobacco's really coming from. Okay. So anyway, we're very excited. We're fingers crossed that this is going to happen. So we did have some advocacy links to send information to local elected officials to support that. And then one other item I want to mention as well too is that as we're again thinking about youth prevention, things of that nature, there is also one other area that's kind of slipped through the cracks, and that is billboards specifically for marijuana to advertise using marijuana products, or hey, come shop at our store, that type of thing. As I'm sure you may have awareness, that is illegal for tobacco and it is illegal for alcohol, but yet it slipped through the cracks for marijuana. So there is 2 bills that are being proposed. House Bill 5134, as well as House Bill 5135, that's been proposed by 6 state representatives. None of them are in our area, but these proposals will be also hopefully moving through this week, is fingers crossed on this, to where it would have it to be where marijuana billboards would be illegal. It'd be just like, again, alcohol or tobacco, just keeping it as consistent as possible. So what we did was we created a letter for Oversight Policy Board that supported that, and we sent that out to all of those state representatives today. And then I will be bringing that tomorrow. So that's kind of my next part of this, is that tomorrow we're having our full board of directors meeting at 1 p.m. We're not having a work session. I will be bringing those 2 advocacy items to the board to see if I can get our full board to take action on this as well too. So I just wanted this group to know, those are a couple things that our Oversight Policy Board was really excited about, because those are both areas that they have wanted for years, and finally there's some movement. So hopefully we can get some traction. The last 2 things I wanted to mention to you is we do have 2 exciting things happening. We have allowed our staff to use Copilot. If you're not familiar with what Copilot is, I would say it's the equivalent to ChatGPT, but for a Microsoft suite. And what it is artificial intelligence, or AI as you may know it. So we're allowing our staff now to start to utilize that for emails, Excel, PowerPoints. Obviously, we've got policies and guardrails and things of that nature in place, but we've had them with this for 2 weeks now. And so far, everybody thinks this is the best thing since sliced bread. So I'll keep you posted more on how this is going. And then the last thing that I will leave you with is we are working right now on pulling together our annual report for fiscal year 25. So those are our big updates. The only other update that I will mention to you is we still have no word from the court as far as the RFP. Nothing's been released as of today at 5:54. So I will leave you with this last message from me, which is Lakeshore Regional Entity wishes all of you a very happy holidays. So that concludes my report.
Thank you. Any questions for Stephanie? All right. Well, Allegan County wishes you a very happy holidays as well.
Thank you.
Okay. I have a couple items to share for Friday's executive committee meeting. One is I did report to them that that I have witnessed an increasing tone of cooperation and a commitment to remain within their budgets from the county representatives from the LRE board. I felt that that was a real significant change in what I heard when there was presentations given to the full board. And barring anything totally unforeseen, there should be no financial problems expected for fiscal year 2025. So try to do even better next year. Fingers crossed. And then the other thing I wanted to mention is we asked Mark to start kind of thinking and maybe putting out some inquiries to different agencies within the county, but you know, we anticipate we'll have a board vacancy when Jane has let us know that she is moving out of the county. I forget, sometime next year. And so, just always keep it in the back of your mind if you see anybody that might be, interested in possibly serving, that, we could offer them an application and start that process. Any questions for me about the executive committee and the report that I've given, or anything from the past? Huh? Okay. We'll go on. Mark, would you please share any items that, from your written report, that you want to emphasize or update?
I think, in view of the fact that we had no program committee today, I think it'd be, maybe I just want to give Gina an opportunity to highlight anything that she might have had that she would highlight it, and then would have been reported to you as a result of that. So go ahead, Gina.
Thanks. I just wanted to, quickly update you on some of the, information in the housing services section. I mentioned that things were rapidly changing in that section, and things have changed. So, we are currently on hold. The notice, of award, was paused. So there was it was actually, Michigan was one of the states who was pursuing legal action against HUD, given the timelines, and before the court hearing, HUD actually pulled, the NOFO. So, we're sort of in a holding pattern right now. We're part of the Balance of State, which is a larger organization, and that's where the money from HUD flows, and then it flows to us from the Balance of State. So it's a bit unique because we have, our grants end at the end of April of 2026, but some of the members of the Balance of State, their grants end January 31st, 2026. And so we are very unclear about what happens. We've seen no reissuance. There was supposed to be, information provided to the judge yesterday, by HUD as to why they pulled, that application essentially, and then, another court date on Friday. So, I'm not sure if we'll hear more about that. Like I said, we are in a little bit better of a position in that our grants don't expire until the end of April. But it's somewhat concerning because it was already a really tight timeline, and we were going to have to redo, at least 3 of our grant applications. And then we were, not going to reapply for one of them, which would have reduced our program spots by 2, although they are vacant right now, so it wouldn't have impacted clients specifically. So, that's kind of where we sit. So, they were originally supposed to be due by last Friday. And so we just are kind of in a holding pattern, because likely the work that we've done, the application will change based on what's happening. So, so I've been getting a lot of questions just about like, how will that impact our clients and things of that nature? And we just really don't know right now. We do, for what the original application was, we are well positioned because it really highlighted making sure that folks had other services. And being that we also provide those services, we were very uniquely positioned in the Balance of State, to be able to offer those, different things, but we really don't know what is going to come in the new application. It was also moving to a competitive process, which, is not how they've been in the past. So that's kind of where we're at. So maybe we'll have different news in January. But other than that, the only other thing that I will quickly plug is if anybody knows any nurses who are looking for jobs, we offer a great schedule, no holidays, no nights, no weekends. So, that's, the only other thing I'll highlight from my report. So, any questions for me? Any? Thank you.
Thank you, Gina. I'll try to be brief on the items that I want to highlight for you from my report. Just a few commentary items mostly. The first page, page 29, I put under the community section that we are beginning to send legislators our board packets, sent the second of those yesterday. And they've been pretty quiet, but I've always gotten a consistent thank you from Representative Smith. So she's acknowledged and received it. I hope we see one of them here someday to take in the meeting and to extend comments as they wish. The next item is underneath the CMHA Winter Conference under the state section. Just again, underscoring that because the registration will be soon on that. Please let Megan know if you're interested. All are welcome, and we just encourage you to participate in that. It's a very good opportunity for board members to become much more familiar with some of the daily issues that are being dealt with in the CMHS, and of course, your roles are very critical for that. That leads into the section related to PXP functions. I'm not going to repeat all that, other than we are awaiting the Judge Yates's ruling. We anticipate that they will continue to affirm the department's right to issue an RFP to determine the number of regions, but they will likely require the state through the Department of Technology Management and Budget to either revise the RFP significantly or to rescind it. But those are the actions that can be taken by the departments. And then he will retain jurisdiction on the case. So if anything doesn't roll forward smoothly, we have the opportunity to, or the litigants, I should say, the plaintiffs have the opportunity to come back to the table and pursue continued justice for what has been ordered. I'll say to my plan, Stephanie is still on this horn. I would say the meeting that was scheduled for tomorrow for my plan is off, so I will be at the LRE board meeting after all. We'll see you tomorrow, Stephanie. And then finally, just on page 31, where there's a discussion about the federal budget for 2026. The only thing I just want to make sure is on the mind of the folks here is that we really are watching carefully what is the impact of the federal government's legislation, Congress's inability to come to terms on the extension of tax credits for people who are seeking healthcare subsidies under the Affordable Care Act. My understanding is that yesterday was the deadline for people to enroll, and they were expected to do that in order to have healthcare insurance next year. But the normal subsidies that people relied on to make it affordable were not provided. So how this is all going to get worked out, I do not know. But we're concerned about the large increase in the community of people who do not have health insurance, because that health insurance covered substance use and mental health services. It was one of the 10 essential conditions that were part of the Affordable Care Act coverage. And so we will have a number of people in Allegan County, I'm sure, like there will be all over the country, who have found the insurance that they had available. Of the 20 million people in the country that had this insurance, may not be able to afford it. So I think the average situation, the premiums for them have doubled. There's awful examples that are much higher and some much lower. But that percentage amount will bar some people from having the insurance they need. And then, of course, as their behavioral needs arise, and they come to our door, they will be counted among those who rely upon general fund dollars if they're not eligible for Medicaid. So we could see an increase in need without an increase in revenue to meet that need. And so I just want to bring that to your awareness, because I'm certain we will hear more about that if the problem persists without a resolution over the next several months. So with that, that's all I have for my report to underscore. Anything that you'd like to ask me, I'm certainly willing to take questions, and yeah, let me know.
Any questions for Mark?
All right.
Okay.
We'll note that it was a lonely night at the Allegan holiday parade. I think it was 6 freezing staff behind the banner that said OnPoint, but we represented you proudly. So I just want you to know, next year you got to be there. Oh, sure. December 5, 7 p.m. Be there or be square.
Thank you.
I'll be square.
All right. Well, now there's another opportunity for public comment. Is there anyone who wishes to approach the board in this time? Okay. I now move that we enter closed session pursuant to MCL 15.2681H to discuss material exempt from disclosure by statute, more particularly the written legal opinion of our attorney, which is exempted from disclosure under MCL 15.2431G. I was told I had to say that specifically.
Okay.
That's my motion. Does anybody support that motion?
Support.
Support. I do a roll call vote.
Roll call vote that requires a 2/3 of the total board membership to pass.
Okay. Glenn,
Yes.
Jessica,
Yes.
Mark,
Yes.
Crystal,
Yes.
Gail,
Yes.
Beth,
Yes.
I say yes. Marcia,
Yes.
Deb,
Yes.
Karen,
Yes.
have enough to go into closed session. Thank you.
Chairperson, I would like to request that Megan and Andre and myself be present for that, if it's possible.
For that motion. Any discussion? All in favor, say yes.
Yes.
Opposed? Motion carries.
I move to adjourn.
Sounds good to me, unless anybody, does anybody, for the discussion, does anybody have anything that they desperately wanted to say that, because we're skipping over board member comments?
Happy holidays to everyone.
Yeah.
Merry
Christmas.
Thank you for this, thank you.
On behalf of the Ellicott County, these are given to you, each board member, and there's extras for the other ones that are not here, as appreciation for your service on this committee. And the pens are also part of that recognition. So thank you very much. Happy holidays, Merry Christmas, and a Happy New Year.